Thank you, Mr. Chair, and thank you to each and every one of y'all for coming here today. I appreciate it. Dr. Lieberman, in 2017, a constituent of South Carolina's 1st Congressional District, who was also a VA patient with a service-related mental health disability, died by asphyxiation while under supervision of the Dorn VA Medical Center. Are you familiar with that case?
I've heard about it. Yes.
Okay. Speaking more generally here, I want to use my time to discuss the VA's approach towards ensuring patient safety in a mental health setting, particularly for those patients who have been diagnosed with a serious mental illness. Can you speak briefly about the policies or safeguards that the VA has in place to protect mental health patients from harm by hospital staff?
We take this very seriously, patient safety. We talk about this. If there is any events that go wrong, we're going to take a look at it and see what happened in these situations. Certainly, if there's suicide, but in this case, it wasn't a suicide. It was
Physical restraint.
Physical restraint, correct. So we look at physical restraints. We monitor for that also under the recommendation of the Joint Commission. We're supposed to take a look at that. We're supposed to minimize use of physical restraint. And when something goes wrong, we have to take a look at it. And our mental health leadership take this very serious.
In particular, it is charged with making sure that the restraint protocols meet certain standards. And you don't have that information either handy, I don't suppose.
Not today, no. We'll be happy to get you that.
Okay. And as far as the personnel, I think you touched on this briefly before, but what processes are in place to ensure the personnel are screened, they're credentialed, and they're retrained periodically to certify that they're aware of VHA policy requirements relating to the safe use of such techniques?
So when we first hire people, we certainly do extensive background checking, doing fingerprinting, making sure that no one has a criminal background. Depending on the level of the staff, if it's licensed staff, we're going to validate that they have the correct licenses. We're certainly going to check their references, important things like that, to make sure that they don't have any history in the workplace showing any concern. And then we go very deep for our providers, making sure that everything they put on their application is accurate. So if there is a lapse in time that they work, why did they have that lapse? Are they physically and mentally healthy? We asked for that, to have a medical recommendation about that.
Okay, I appreciate it. And so you'll supplement the record and provide that information as far as who's tasked with training them and what that protocol is and how often it's reviewed, correct?
Absolutely.
Okay. And, obviously, as we're seeing when our men and women return home from service, so many of their scars we can't see. And this is becoming a difficult issue to deal with, but they deserve the best care that we can give them. And I applaud the VA for what they have done, and we're just seeking the areas in which they can improve upon. And I appreciate your service. And my question to you is, what else can we as members of Congress, specifically this committee, do to ensure that this growing area of concern, men and women with mental health issues, PTSD after coming back from doing so much for our country, are awarded the care that they deserve and the care that they need? Are there any other tools from us that you would request?
I really want to emphasize how dedicated, how well-trained, how most of our staff are that do the right thing every day. I have a concern when we just focus on the negative, that it actually harms the veteran who's on the fence about whether they should come to the VA. We have to tell both sides. We have to tell the good stories, because we hear that veterans hear about these issues, which are certainly concerning, and we certainly have to learn from them and improve. But we also have to talk about the quality of care that VA has to offer, and that especially for mental health care. And I apologize for what happened at Dorn. That is a very upsetting and issue there for that particular case. But we have to get our veterans to be willing to come to us, and I just get worried when we just focus on negative in forums that it's harming the veteran.
Yeah, and I would say in Charleston we have a 5-star facility, and very proud of that facility there in Charleston. I think overall that's the impression there, and unfortunately, though, we do have to focus on some of the terrible situations we're confronted with, and how to make things better and to ensure that they do not become a pattern. And I think that was the purpose of being here today. So again, I thank you for your service, and each and every one of you all, and I would yield back.